Senator Bennett, somebody stands and confronts you and says, I hear you've been talking to people about putting up the eligibility age for retirement for Medicare. I have worked all my life on the lines. Physical labor, I'm 63 years old, I ache all over, I have terrible back pains. You're going to tell me I can't get this till I'm 67 or 70 years old? I'm not going to make it. I'm not going to be able to have that nice white-collar job that you have. We're in Stryver City, not in Washington, where there are all these business consultants when they get out of the Senate.
We're not very sympathetic to that age group.
And I'm going to say to him, raising the age is the kind of simplistic approach that people who used to be on CNN talk about.
I agree.
Medicare is the best Blue Cross Blue Shield fee-for-service indemnity plan of the 1960s, frozen in time. It's like a bad Woody Allen movie. Medicare needs to be completely rewritten around the way we practice medicine today, which bears no resemblance whatsoever to the way it was done in the 1960s. And in the process of doing that, we can bring the cost of health care down, not only for Medicare, but for private insurance, which always follows Medicare because that's where most of the money is.
And we have great bipartisan agreement.
The fact about Medicare is that when it was signed into law in 1965, the typical American lived to about 70. Today they live to about 78. And healthcare costs were roughly 1/3 as a function of GDP, as a measure of GDP.
So let me give you a few additional facts, which is I'm so glad we have so much bipartisan agreement. We can lower healthcare costs. We can take steps to lower healthcare costs. Issues on Medicare are, it's true, Medicare is a growing part of the federal budget, but it's also true that if we have the same growth of Medicare that we've had over the last 3 years, where it's been very low, that's going to take $500 billion over the second decade, over the next several decades, or the next 2 decades, which is which dwarfs the amount of money that we do in raising the Medicare age. Now, the thing is, people talk about raising the Medicare age. I would just like to say, I believe in raising the retirement age. That was a good step we took, because we believe that you should retire when you're older. But we also believe people are entitled to health care. And we shouldn't make people, when you raise Medicare age, you're actually increasing the cost on business.
This is a non-starter for you.
Yes. Right, no, but I think I do want to have comedy on savings in the Medicare program.
Let's just ask.